Over half the people on the planet will be either overweight or obese by 2035 if current trends prevail, according to a study by the World Obesity Federation. And Gibraltar is no exception.
It's a big problem. It's 1 in 4 of population in Gibraltar or even UK is obese, and in 2050 it's going to be 1 in 2. So it's a big health problem. It's a big public health problem, and we are incapable to tackle this problem yet.
Obesity is associated with health risks including type 2 diabetes, high blood pressure, heart disease, and even cancer. And being obese can mean that you're worse affected by other unrelated conditions, as we've seen with COVID. But as many of us know, it can be hard to lose weight. I spoke to Tanya and Keith, both of who have struggled with obesity in the past.
Before having the op, I tried a bit of everything. Dietitian, certain supplements, increasing my activities. The reality is that there's day-to-day issues and not having the time. It's no excuse, but obviously it doesn't help.
When you go into the supermarkets, obviously, the special offers, etc., obviously they're always plonged on there, and the first thing that you see is our sweets, chocolates, and not the healthy options that should be on the shelves.
The obesity is, of course, a very complex problem, which is taking into account genetic factors, environmental factors, as well this obesogenic environment that we have food everywhere, and our body physiologically is prepared to survive and to accumulate, because we are not prepared to starve.
The GHA offers resources to tackle obesity in all its aspects, including psychology, diet and hormones, as well as endoscopic and surgical operations. Both Keith and Tanya had gastric procedures done.
I had the gastric bypass, which is the Rouen Y. Obviously, people might think it's the easy way out. It's not. It's obviously a long program. You have to go to psychologists, you have to go to dietitians, and obviously change your mindset before you have the actual operation done.
It's not that you put yourself on a list and you get the op. You have to go through an entire process, and that process, I think, is essential, because it helps you understand where you want to be at, and it's not a miracle op. It's just a tool in your bag that will help you get to where you want to be at.
We have a very successful bariatric program in the GHA. It's working for the last 5 years. We operated more than 100 patients already, and we are changing their lives. But as I told you, surgery is not for everyone. It's only for the very severe cases. And this is the last step of a program that patients can come to get dietetical advice at the PCC from the doctors. They have to begin with their own GP just to get advice from the doctors for some strategies to increase the physical activity and to lose weight.
Losing the kilos is easier said than done, but the GHA is keen to emphasize that you don't have to go it alone, with support available for those taking the first steps towards a healthier future.